Hello, I'm Dr. Tim Williams, a radiation oncologist at Boca Raton Community Hospital in Boca Raton, Florida, and I'm glad you found me. First, if you have the diagnosis of cancer, you're not alone. Over 1 million people a year in this country have this diagnosis, and it's important to realize that there are many people that are here to support you. As part of the process, I want to take a few minutes to talk to you about how things are going to work if you indeed do have to have radiation therapy, as about 60% of all cancer patients do. I think the most important thing for you to do is to be sure that you write everything down. I see many patients, and oftentimes they'll forget something that they wanted to tell me, so always have a piece of paper and a pencil with you. It's also very important to bring somebody with you if you can, either a spouse, a family member, somebody from out of town, a grown child, something like that, so you have a second set of ears to hear everything that we're saying. It's very important that they write everything down as well. Never hesitate to ask questions, because it's very important that you understand exactly what it is that we're trying to accomplish and how we're going to try to accomplish it. What is radiation? It's true that it's a sort of a mysterious treatment because you don't see or feel the beam as it passes through you. But we're able to use it very precisely. It's able to kill tumors, and yet the way we deliver it these days, we can spare normal tissue. As it turns out, we use radiation in different ways. Sometimes we'll use it just to kill the tumor outright, and we won't need any surgery or chemotherapy. Other times, the patient will have surgery first, and then we use radiation as something of a mop-up operation to kill any potential cancer cells that may have been left behind. More commonly these days, we're using it with chemotherapy, where the patients will get chemotherapy as part of their overall treatment, and sometimes the chemotherapy is used as a sensitizer. It actually can make the radiation work better. The most important thing is to be sure that you understand the nature of the radiation, the reason that we're giving it to you, and that you talk with your doctor so that you understand how the treatment is going to be given. The main thing you have to realize is that there's an entire team that's focused on only delivering your care precisely. As the radiation oncologist, we're the director of the whole team, but we have a radiation physicist whose job it is to make sure that the machines are calibrated properly and delivering the right amount of radiation. We have medical dosimetrists whose job it is to calculate the beam geometries and do what we call the dose gradients, so we know where the radiation is going and where it's not going. We have oncology nurses who meet with you to talk about the side effects of therapy and help you as you go through the daily treatments. And we have radiation therapists who are people who are specifically trained in knowing how to deliver each radiation treatment. So the important thing to realize is that you're part of that team, and as you go through the course of treatment, you may be seeing many of these people as they interact with you and your treatment on the table itself. Never hesitate to ask questions if you're unsure about what's going on or who the person is that's treating it, because I'm responsible for everything that happens to you in the office, but many of the people that I work with will be providing some of the actual care itself. I think it's very important to realize that there can be side effects from radiation therapy treatments. Historically, the main side effect has been fatigue, but it's a very difficult symptom to describe. It's not really an exertional type of a fatigue at all. The English language really has no word to accurately describe this radiation malaise. The best word I've ever seen a patient use to describe it is a blah type of a feeling. There's sort of a blah-ishness that you can get from the radiation. We always tell people about it so they'll be warned that if they do experience it, it's just a normal side effect of the treatment. Sometimes it'll start maybe 2 weeks into the treatment and then it goes away a couple of weeks after the treatment. It always does go away. Beyond that, radiation side effects depend on the area that you treat. For example, if I treat your oral cavity, you're going to get sore when you swallow and get a dry mouth. If I treat your chest, you can have a cough or some soreness when you swallow. If I treat your abdomen, you can get nausea, maybe some diarrhea, or some abdominal pain. The important thing is to discuss the matter with your doctor so that you can go through the side effect profile for your specific course of therapy. Many patients ask me what they should keep in mind as they're going through the radiation treatments. What I tell people is that the main thing is to be normal. you're going to be going through a long course of cancer therapy, and it's important not to let it degrade the quality of your life. Try to do all the things that you normally do and keep up with all the things that you normally keep up with. There will be some side effects, but the team will work with you to make sure that those side effects are ameliorated as much as they can be. Try to eat a balanced and nutritious diet, and most programs will have a nutritionist that can meet with you, or at least the nurse, to go over what the type of diet is that you should be, looking for. You have to also be sure to get enough rest to be sure that you can, tolerate the radiation malaise, the blah type feeling if you actually get it. The main thing, though, is to seek support if you think that you need it. The whole team is there for your benefit, so never hesitate to ask questions and stay involved in your therapy. The single most important thing that I've seen over the years is for the patients to stay involved in their therapy, keep asking questions, and keep up with what's going on with their overall care. We're here to help. If you have any questions, please go to rtanswers.org. Thank you very much for listening.